I can't explain to you how incredible the A&E placement has been. It has been the most unbelievable experience of my entire life. I had 2 attempts on the same patient to put that cannula in and I failed, and that definitely bothered me a bit. This evening I witnessed something that was quite traumatic. An elderly individual that had a cardiac arrest that I was involved in everything with. I had to do CPR on this person, but unfortunately they were brain dead by that point. That patient unfortunately did die. It's just so diverse. There's so much to see and do whilst in the A&E department. Being on these shifts and speaking to these patients really shows you how little you know. But when I'm on these wards and I'm, attending patients with a doctor and then the doctor sits with me after to discuss it, it really shows me how little I know. But the fact that in year 3 on my first clinical placement in hospital, I actually sutured a proper wound, closed the wound myself, that just felt incredibly rewarding. This is the best rotation to have. So hopefully by watching this video, you're gonna get an idea as to why that is. So welcome to a week in the life of a third-year medical student on a A&E rotation at the emergency department. In this video, I'm going to be showing you everything from what I get up to, how I balance my time, how I balance keeping fit, exercising, what it's like being in the hospital wards, getting sign-offs and everything in between, and obviously all the revision that we've got to do between that, just so you guys can get a better flavour of what to expect if you've got an emergency rotation. And a lot of people say that this is the best rotation to have, so hopefully by watching this video you're going to get an idea as to why that is. So Monday tends to be the day that I start by ticking off a few of my admin related tasks off my list. And for me, that is sealing the deal with my accountant that I've been looking for absolutely donkey's years. By the way, it's so expensive. So I need to call and confirm my accountant. I need to pay for my next subscription for a service that I subscribe to. But yeah, that is basically what I'm starting with, because at 12 o'clock midday, I am in the A&E department until 8 p.m. But between that, there is a seminar session from 4 till 5. And that's because every week, whilst on the A&E rotation, you have a seminar session every day of the week from 4 till 5 by different doctors that work in the A&E department, and it's all things that are relevant to that. So things like shock, things like CPR, things like ABCD, things like DVTs, things like pulmonary embolisms, all of the most common presentations that you tend to get in A&E. So it's actually been really, really helpful every week having those seminar sessions. I really enjoy them. And obviously if you're on placement, you can just get excused from the placement to just go to that teaching session. Really good though. All right, so I'm just about to get off. I've made my sandwiches for lunch with 2 eggs for a good source of protein, protein bar, apple and an orange, and of course my electronic stethoscope, and my scrubs are in there as well with my badge and my little light. Water bottle, coffee flask, iPad for sign-offs and documenting everything, and banana for now. Now, to be honest, the cycle to uni actually works for me because I'm generally running pretty late, so I'm rushing, which gives me a good bit of exercise before a long shift. Now, since I'm living with my girlfriend at the minute, we live right beside the Lowry Hotel, so cycling to university or where my hospital is only 10 minutes, so really convenient. Now, since my first block is A&E, there are endless opportunities to speak to patients, do examinations, practice my UPSs, which are my clinical skills, such as venipuncture, cannulation, and urine dipsticks, peak flows, all sorts. The goal today is really just going to be immersing myself into A&E, getting as much experience as possible, again, speaking to patients, taking histories, and really just coming up with differentials. Massive advantage being at A&E for your first block, because the amount of patient interactions I've had since starting over the last 3 weeks has been crazy. Like, I already know as soon as I go into my placement, within the first hour I'm going to have spoken to like 3-4 different patients. I'm going to have presented all of these histories to a doctor, to a consultant potentially, and discussed differentials and investigations and various different things with them. So, it's such a great place to just learn, observe, but also be practical and get involved. plan today really is just going to be speaking to as many patients as possible and also practicing as much cannulation and venipunctures as possible, because I have spoken to some of the other students on different placements and they don't really get the same opportunity that we do in terms of venipunctures, putting cannulas in, which to me is probably one of the most exciting things, just because I'm really excited by the idea of doing anesthetics, and of course anaesthetists spend a lot of their time putting needles into people. So yeah, my goal today is just throw myself onto the ward, use my iPad, take some notes here and there, write out some patient assessments, because we have to do 3 of those a week. We have to do 1 physical examination, so do 1 of those, and also present it to one of the doctors and get signed off, because we've got to do those 3 patient assessments, 1 physical examination, and 1 standard presentation to one of the doctors. And honestly, I can do that within the first 2 hours. Like, so much opportunity at A&E to do all that. And then I'll probably just head over to the acute medical unit, which is where, you know, everybody needs bloods doing. Everyone needs cannulas putting in, and, you know, so many opportunities to just do stuff. I'm really, really gonna miss this placement after this week. But yeah, it's time to head over there. And I'm back after a very busy afternoon in A&E. It was actually quite slow to start with because there wasn't much going on, because from midday you tend to have the people that are handing over. So it's really busy at 8 a.m, 9 a.m, 10 a.m, but around 10 till 12 people are kind of settled in and people have been passed on to different departments. So to be honest, it wasn't really busy at the start, but I did find someone that needed a cannula. I tried to put a cannula in the hand and I struggled because I used the too big of a needle to get the cannula in and caused a little bit of discomfort to the patient, and that really annoyed me because normally I'm quite good with cannulas, so it bothered me a bit. But the person wanted me to try on the other hand, so they were really, you know, supportive of that. So I tried it as well with the doctor who watched me, and I used a bigger needle again. The doctor insisted that I used a bigger one, even though it was a small vein. And this time I got it in, but I put it in through one end and out the other, so it caused a bit of pain and a bit of swelling in the patient's hand even after I pulled it out. So we decided to just abort mission and take the cannula out, full stop. And that really annoyed me because I had 2 attempts on the same patient to put that cannula in and I failed, and that definitely bothered me a bit. Can't help but feel a bit frustrated, but you know, that is normal to have these experiences, especially when you're doing cannulas and you're practicing and you're training, especially in year 3. It is all about just practicing and finding a technique that works for you. I've been trying different ways of holding the cannula with my hand, from the above approach to like sideways, which is a bit more stable. But yeah, that really bothered me a bit, to be honest. But then after that, I had a really complex patient to talk to with COPD. It seemed as though it was a COPD exacerbation, but the blood pressure of this patient was so low. It was like 90 systolic, which prompted us to think, are they in shock? Because he definitely had presentations of hypovolemic shock and potentially cardiogenic shock, because he had fast AF and a heart rate of 155. So that's already ringing the alarm bells of, you know, we need to do bloods on this person, see what the potassium is. The potassium was normal. Everything else was normal as well in the bloods. So yeah, could it be an infection? Could it be pneumonia? But also this person had a recent lung abscess, so is it infected? They did white cell count and they noticed that wasn't raised, so that kind of ruled out septic shock. Other than that, really complex but really interesting, and being on these shifts and speaking to these patients really shows you how little you know. Like, I always thought I knew my stuff and I felt like very quick with things, especially in preclinical years, bioscience related stuff. But when I'm on these wards and I'm, you know, attending patients with a doctor and then the doctor sits with me after to discuss it, it really shows me how little I know, because they say, and what would you expect for that? And what would you do for this? Okay, so what's the treatment plan? And I'm like clueless. And it's really quite debilitating. I feel like I have to keep reminding some of the doctors, like, I am just a 3rd year, just so you know. Like, I really haven't learned that yet. Like, reading ECGs, they're like, what can you see there? And I'm like, it's irregular. The QRS is wider, and I just don't really know the approach to spot things. It can be quite knock your confidence a bit, but you just have to keep an open mind and keep realizing that, you know, this is a place to learn, and the doctors are incredibly supportive as well. So that's a real positive. They definitely don't make you feel stupid. They're like, don't worry, it's fine. Like, I was in your shoes at one point. So it is a very, very supportive environment, but it definitely shows me that I've got a huge way to go, like a really, really long way to go. I feel very up to speed with my examinations, good at my exams, good at my history taking, But in terms of clinical reasoning and clinical skills, I've got a lot of work to do. But now it is 4 p.m. and that means I have a 1-hour seminar session and then I'll be back on the wards for the rest of the evening. But I'm starving, so I'm gonna have lunch during the seminar session because there's no time for breaks. Just literally come to the locker room to get my lunch and go to the seminar. Speak to you in a bit. It's been a long day. 7:10. I'm leaving an hour early. I'm gonna go swimming though, so I need to nip home, get my swim stuff, and 2 hours of training. Oh, so good. I did 2 more cannulas and I smashed them both times. I got them both in. The first one was an elderly patient and it was difficult to get enough blood flow from the hand to make it like flow out into the tube. Then I managed to just tap on the wrist a little bit and just like stroke it a little bit, and then it gradually started just squirting out. So I got some really, really good bloods there. Did a urine dipstick as well and watched a PR exam, watched a testicular exam, and yeah, it's just so diverse. There's so much to see and do whilst in the A&E department. The teaching session that we had for an hour was on sepsis. So we had another good introduction to that because obviously sepsis is heavily drilled into people working in A&E. You need to spot it, you need to see what signs are relevant, you know, lower blood pressure, tachycardia, high heart rate, essentially that's what that is, you know, fevers, temperatures, all sorts, and just kind of know when to raise the alarm bells and figure out what's what. So good session there, and yeah, I managed another 3 hours in the A&E because I have swimming at 8 p.m. So I've got swimming from 8 till 10. I'll come home, probably pass out with exhaustion, but then I'll probably need to eat as well, so I'll need to throw some food together. And then I'm up tomorrow at 7 a.m. because I'm back in A&E from 8. That swim wiped me out. It's now 10 o'clock. I need to get back, eat some food, and then do it all again tomorrow. Okay, so plan today. Since I've got all my UPSA sign-offs, I've got 9 out of 10 except the scrubbing, which I can only do on my surgery placement, is to try and do a neurological exam. I feel so good about all the other exams, except the neurological exam. So I'm gonna practice that. What a long day. Just had a teaching session, just finished with that. Pediatric emergencies. Very, very interesting reading about epilepsy, seizures, foreign objects. But I'm home now and I've got another lecture.
I got a new job.
You got a new job? What is it?
Personal shopping assistant.
Wow. But I've got a lecture online. It doesn't stop. Now, unfortunately, upon reviewing all this footage, I realised that my microphone wasn't turned on. But as you can see, Jenny came home from dancing, so it was lovely to see her before filling you guys in on how amazing today's placement was. I managed to get 2 cannulas in myself without any assistance, and then shortly after was asked to take bloods from a patient with absolutely nobody supervising. We then hit Vibe for a wicked workout where I very quickly realised that I'm nowhere near as fit as I thought I was, before coming home and having dinner with Jenny. Then, before bed, I reviewed some of my videos that were sent by my editors, and then spent some time working through this week's TCD content on breathlessness, building question banks using my favourite resources, Past Medicine and Zero to Finals. And good afternoon. I had an amazing workout this morning at Tribe. As you saw from the footage there, I feel really good and positive about today because I'm back in hospital. And as you guys know, you only have to do 3 different slots at A&E, either a morning slot, a lunchtime slot, and an evening slot. So this evening, I'm gonna be in A&E from 5 p.m. till midnight, so I'm super excited about that. Just had some delicious food cooked by the incredible Jenny. Lots to get through, lots to get on with, and very excited to get back on the wards and fill you guys in. Coffee, check. Bag full of goodies, check. But first, I've got a 1-hour tutorial seminar at the A&E department about, I don't know what, but I'm going to tell you after. Catch you there. What a day. So it is midnight, and I have had the most incredibly insightful and interesting shift at A&E. Like, I can't explain to you how incredible the A&E placement has been. It has been the most unbelievable experience of my entire life. I feel so incredibly grateful for the opportunity to be able to work alongside some of these most incredible people, the most intelligent people that I've ever come across, the most composed and well-collected people that are capable of the most incredible procedures. I'm lost for words about what I've seen this evening, and the way that the doctors have behaved and handled everything is just phenomenal. It's given me a newfound appreciation for these people and for these people that work at the hospital. And being on this A&E placement has really done that for me, and I think that's an incredible thing. This evening I witnessed something that was quite traumatic. I actually witnessed a few weeks ago an elderly individual that had a cardiac arrest that I was involved in everything with. I had to do CPR on this person, but unfortunately they were brain dead by that point because they were very old and they had a serious cardiac arrest. And I was very involved in that a few weeks ago. That patient unfortunately did die. That really affected me. But I realised that being on the A&E wards, I'm going to see a lot more of that. And today was another of those days, but to the furthest extent, because this is a young person that was stabbed, was murdered, and from the moment that this person was rushed into A&E, the way that the doctors all worked together, including the nurses as well, and opened up the person's chest, tried to do everything that they could because the stab wound had actually punctured the heart, the IVC. Just seeing that and being a part of it and witnessing it and seeing the parents' reaction when they were informed, it was heartbreaking, it really was. And I think it really does a certain level of character building for anybody on this kind of placement or anyone at medical school that witnesses this kind of thing. It takes a certain kind of person to be around that and to witness it, and you know, the consultants and doctors that were involved in that could deal with those kind of situations and, you know, do their absolute best for the people that they're treating. Absolutely remarkable, wonderful, everyone playing a role, everyone had a responsibility, and it was just a very unfortunate situation, and I think it really does shape you as a person. I'm 28 and I've experienced a lot of things in my life, and nothing in my entire life had as much of an impact as being in A&E for the last 4 weeks, more precisely. You know, aside from that, I got my first opportunity to suture a wound. There was someone with a big gash and, you know, the person needed the wound suturing, and I watched one of the regs do 6 of the stitches, and then he said, "Do you want to do one?" And I was like, yeah, of course. And I just went there, and I have done some suturing before because I'm part of one of the societies called Scalpel, which is a surgical society, and on one of their days they had a suturing session, and I went down to that and practiced it on bananas, potatoes, and got good at it and figured out how to suture. And now I do know how to suture, but the fact that in year 3 on my first clinical placement in hospital, I actually sutured a proper wound, closed the wound myself, obviously whilst I was being watched by the doctor, I just felt incredibly rewarding. So yeah, I've just had an amazing experience, and I also injected the lidocaine as well superficially into the skin and around the wound. So I've done so much. I spoke to patients, I've examined patients, I've presented to consultants. Like, it's unbelievable, honestly amazing, and I'm so grateful for this opportunity. And I really hope, if you're thinking about medical school and you're unsure whether it's for you, clinical years will really show you whether this is for you, because it's the most unbelievable experience and it's unlike anything else. I've done a degree before, I did biomedical sciences. This is nothing like that. This is not even like, not university, forget university. This is medical school. This is a completely different thing. Only once you're in it can you understand it. It's its own entity, it's its own thing. Nothing compares to it. The interactions with the patients, the experiences that you have on placement, the consultants and doctors that you meet and learn from, and the teaching that you get, and it's just unbelievable. The personality building that you'll have in the process, the communication skills that you'll develop. You become a better person, you become a better talker, you become a better human being in all of the ways, and you just become more empathetic as well. when you're speaking to really sick patients on a daily basis and seeing how bad it is for some people, it really changes your perspective on things. And I'm so grateful for this opportunity. I really am. And I think on that note, I'm gonna call it a night and go to sleep. But I have got some curry that Jenny did cook for me earlier that I've just reheated. I actually had to get a McFlurry on the way home because I just needed a moment to process everything that I'd just seen over the last 6-7 hours. I need curry though. So yeah, I'm gonna eat this, call it a night, catch you tomorrow. It is Thursday evening, actually, it's 6 p.m. Today I've not done a huge amount, to be honest. We started with our clinical debrief session, which was a 2-hour session it's usually with a GP, it's supposed to be with a GP, but for our placement in A&E, we've actually had a sexual health nurse who's been sitting in. So that has basically been a chance for us to talk about our experiences on the wards, what we've found, any patient presentations that we weren't sure of. And the purpose of these sessions is actually discuss it with the GP running the session and the rest of the group to make better sense of what we saw, why it happened, and why the treatment plan was given, and also just to give a bit of clarity on anything that we're concerned about as well. But of course, we were a little bit limited this block because we had a sexual health nurse who didn't have the same knowledge, of course, as a GP to help us understand things. So to be honest, the clinical debrief sessions hasn't been as helpful as I've spoken to with other pupils on the course who, you know, have been able to make sense of things, who've understood structured approaches to things that doctor would have been taught. So that wasn't the most helpful session of all time, without being too critical. But then after that, I have just basically had to come home and I just had a few bits and bobs that I needed to tie up, work-related things outside of university, you know, in terms of my DJing, in terms of my accountancy, in terms of all my other back-end admin-related things. My life is so hectic, but we move. But yeah, then after that, I did actually have my final debrief session with my head of this block. And that basically involved me just sitting down at the hospital with him and one of the other doctors who was helping running the student experience placement. And it was just some feedback, really, a 10-minute opportunity for me to talk about my experiences on the placement and also any feedback that they had on me and any other doctors on the wards. So all in, it was a really good meeting and it was constructive, got some great feedback in that, you know, I got so many sign-offs, done everything that I needed to do. And yeah, for me, I'm just kind of like, it's Friday tomorrow and it's gonna be the last opportunity I have really to go back on placement and back in A&E to experience all the things that have been so amazing about this placement. So I'm kind of tempted to just go back and do a couple hours and just experience it really, because it's an amazing, amazing thing. So yeah, that is basically a roundup of today, Thursday. Not much else to tell you guys other than for the next few hours before I go to swimming at 8 till 10 p.m. I'm gonna do some more question banks, some more of this week's case on OneMed, and just think about some of the knowledge that I've learned this week. So that's the plan. And so I had a wicked time at swimming, feeling really healthy, and I've just come home, had some pasta, and just spent some time organising my playlist because I'm playing Saturday night at Tattoo. Amazing restaurant, by the way, you guys need to check it out. But I'm gonna call it there. Good night. Oh, good morning, you guys. So it is 10:47, and for today's plan, I'm gonna go into A&E for my final shift just for a few hours, just because I need to get 1 or 2 things signed off. Reason for that is each week you need to do 3 patient assessments, 1 physical examination, and 1 patient presentation. And it turns out throughout the entire course of this ICL, I kind of got a little bit complacent with my patient assessments and I've not actually filled them all in. First few weeks I did so many. So I've actually got 2 more patient assessments to fill out. So I need to go and speak to 2 more patients, do a full assessment, and fill out those patient assessments so my sign-offs are complete and I am good to go. However, ICL is a formative block, it's not summative, so even if you do fail, it's not the end of the world. So I'm gonna get that sorted, and then after that, we've got a TCD session, 2 hours of that, where we are going through this week's case, which is on chronic breathlessness, and we'll have a consultant with us working through the case, and that's the plan for today. just finished TCD, which was really good. It was on congestive heart failure, but now I'm just going to nip over to Noop's to get some milkshake for Jenny. I'm going to surprise her at work. As I say, I went into hospital for a few hours for my last ever A&E shift. It wasn't actually scheduled. The department's just so nice and so welcoming to allow me to just come in and just do an extra few bits and bobs. So I ended up doing a VBG, unassisted, completely on my own accord. I was informed by the doctor that they wanted a VBG on a lady that had a intense nosebleed for, you know, the last 6 to 8 hours. And we needed to do her bloods again, obviously to assess whether she was anemic. So I just went ahead, got the butterfly needle, got all the stuff, did a full blood count, and yeah, I wasn't actually able to see the results because I had to leave, and then we had a full 2-hour themed clinical debrief on theme clinical discussion, TCD, on congestive heart failure. Actually surprised me how much I can remember from preclinical years about investigations, signs, symptoms, and the management and treatment of congestive heart failure. I just remember it from, I think, year 1 where we did it. Really, really good session. I definitely think to get the value out of these sessions, you've got to contribute, you've got to be involved. And the reason for that is obviously you're in a lecture theatre, there's probably about 20 to 40 other people in there, but it is very interactive. The lecturer will be asking questions throughout, and unfortunately the way it is structured is to get the benefit, you have to contribute, you have to answer the questions whenever he proposes them, and you get a lot from that. But you know, with it being in a big group, some people can sometimes feel a little bit reserved to contribute, especially if you're sat at the back, which I can understand, but that's why I sit at the front. So that was amazing, and yeah, for the rest of the evening I'm going to be DJing at Tattoo, so I'll insert some footage right here so you can see what that looks like when I play from 6 PM till midnight at Tattoo restaurant in Manchester. But anyway, that is where I'm going to end this video, so hopefully you've enjoyed this week in my life at A&E, and you can see what it looks like, and it gives you a bit of perspective on what to expect if you have a placement in the emergency department in Manchester. So there you guys have it. If you've enjoyed it, hit the like button, hit the subscribe button as well, follow me on all the socials, and as always, I shall see you in the next one.